So you've heard about bipolar disorder, but you don't really know what it is, what causes it, or how to correct it. Well, over 5 million people in the United States alone suffer from bipolar disorder, and furthermore, it has a heritability rate of approximately 70%. The symptoms, often referred to as the phenotype, are unexpected shifts in mood and energy that affect one's ability to go about their day-to-day lives. These moods can be extreme highs of euphoric energy to extreme lows of manic depression. Hard-working geneticists have tried finding the root of the problem, but they cannot seem to narrow down any genetic mutations that directly result in bipolar disorder. Instead, they have found certain single nucleotide polymorphisms, abbreviated as SNPs, that have little impact individually, but do increase the risk of bipolar disorder when multiple are present. These are some of the genetic mutations that SNPedia has specifically pointed out as increasers of risk for bipolar disorder. Now that we have a better idea of what the phenotype and genotype of bipolar disorder are, how can we help people with this problem? Interestingly, Shin et al. Points out that lithium treatment works very well for Asian patients of Han Chinese descent with certain variants of the GADL1 gene. However, other than this one specific case, there are not many reliable methods of treatment other than psychiatric help and controlling medicine. Even without exact treatments, understanding each patient's genotype can be crucial in determining which specific medications and amounts that patient should take. This is a major benefit for those who undergo genetic testing for bipolar disorder. Those who take related genetic tests further inform their doctor and allow him or her to offer better, more specific treatments.
Having said that, there's still some cons to taking a genetic test for bipolar disorder. The most notable downside is the fact that the results of a genetic test do not actually constitute as a diagnosis for bipolar disorder. In order to actually receive any treatment for the disorder, you would have to go through a psychiatrist or psychologist who would likely start you off with psychological evaluation. That way you have a DSM certified diagnosis, and you'd wind up paying for both the SNP chip and the diagnosis anyway. All told, the process could set you back by up to $65,000. Also, as with anything concerning human behavior, you always run the risk that knowing your genetically predisposition to having a disorder may influence your responses to diagnostic tests, and it could potentially result in a false diagnosis. All told, there aren't really any moral implications behind this genetic test, but you should still make sure you consider all your options if you feel like you're at risk to show symptoms of bipolar disorder.